So, you've been having some strange and sudden vision problems, and your doctor mentioned something called a VEP test. It can sound a little technical, I know, but in this explainer, we're going to break down exactly what that is, why it's so important, and what you can expect every step of the way.
You know, it is just so confusing, and frankly, it can be pretty scary. You go to the eye doctor because something's wrong with your vision, but they look you over and say, your eyes look perfectly healthy. This happens all the time, and it leaves you with that big question. If my eyes are fine, what's going on? Well, here's the key thing to remember. Seeing is a team sport. It's a partnership between your eyes and your brain. The problem might not be with the camera, your eye, but with the cable that's sending the picture from the camera to the main computer, your brain. So that's what we're going to talk about. How do we check the health of that cable? This is where we get right to the heart of the matter.
That cable is your optic nerve, and honestly, thinking of it as a high-speed data cable is the perfect analogy. Its whole job is to take everything your eye sees and zip that information straight to your brain so you can make sense of it all. Without a healthy optic nerve, you just can't have clear vision.
And you know, any good cable needs proper insulation, right? To protect the wires inside and make sure the signal doesn't get scrambled. Well, your optic nerve has that too, and it's called myelin. This protective coating is absolutely essential for making sure those visual signals travel super fast and super clear.
And this picture shows you exactly what we're talking about. On the left, you've got a healthy nerve. See that thick, strong insulation? That means the signal is flying down the line, no problem. But on the right, if that insulation gets damaged or worn out, the signal can slow way down, get weaker, or maybe not even make it through at all. And that is what can cause vision problems, even when your eye is totally fine.
And this is where the VEP test comes in. Think of it as a diagnostic test for that data cable. It's a really simple, non-invasive way for doctors to measure two really important things: how fast the signal is moving down your optic nerve, and how strong that signal is when it gets to your brain.
All right, so let's talk about the test itself. Knowing exactly what to expect can really help take the anxiety down a notch. We're going to walk through it right now.
First things first, how much time do you need to set aside? The good news is, it's quick. The whole thing, from start to finish, usually takes about half an hour. It's a really straightforward procedure.
Now, this is probably the most important thing I'm going to tell you. This test is completely 100% painless. I promise. There are no needles, no shocks, nothing that's going to hurt. You basically just get to sit back and relax while the machine does all the work.
So what actually happens in that half hour? It's as easy as 1, 2, 3. First, a technician will place a few small sticky sensors on your head. They kind of feel like little stickers. They don't hurt at all. Second, you just watch a screen. It's going to show a simple pattern, usually a flashing checkerboard. And third, while you're watching the screen, those sensors are just quietly recording how your brain is reacting to the pattern. That's it.
Okay, so the test is over. What now? What are your doctors actually looking for in all that data they just collected? Let's take a look. It really boils down to two main things. If the signals from your eye are showing up to your brain a little slower than they should, that suggests there might be a problem with the insulation, that myelin we were talking about. But if the signals are on time but they're just weak, that could point to some damage to the actual nerve fibers, the wires inside our cable.
And this information is just so valuable. It helps your doctors confirm that, yes, the optic nerve is the issue here. It also tells them what kind of damage they're looking at, which is key for treatment. And, really importantly, it can give them clues about a condition that might be affecting other parts of your body, not just your eyes. That's why it's such a crucial test for diagnosing conditions like multiple sclerosis.
Exactly. It helps them see the bigger picture. Let's say a person is also having issues with, say, numbness in their arm. If the VEP test also shows damage in the optic nerve, it helps the doctor connect the dots and see that something is affecting the central nervous system in different places. It's a huge piece of the diagnostic puzzle. Look, I know that being sent for yet another test can feel pretty frustrating, but the VEP test isn't just another appointment. It's actually a huge step forward. It's one of the best ways to start getting some real, concrete answers. And that's really the main takeaway here. A symptom like sudden vision loss, it's complicated and it's confusing. But the VEP test is the opposite. It's simple, it's painless, and it gives your doctor the clear data they need to figure out what's really going on and how to help you. Ultimately, this test is about moving forward. It's about taking all that uncertainty and confusion and turning it into information. By understanding what this test is all about, you're already taking an active role in your health and starting down a path toward clarity and a solid plan for the future.